I can share from personal experience. In the aftermath of February, I became kind of pretty outspoken against Islamophobia and its lethal impacts. And I brought those conversations home here to UCSF. I was on a panel for a grand rounds called Challenging Islamophobia. And in it, I was sharing, examples or stories that I have experienced on the wards in my hospital here in San Francisco. And, with the hopes that I'm telling my colleagues how I found it helpful to stand up to bigotry. And the basic answer is to not be silent when you see it. And I thought it went really well. And just a few weeks ago, I was senior on the wards. And, you all know how rounding is, and you have like 10 people on my team, and I am the senior leading the wards, leading the rounds. And the last patient we're rounding on looks at me, and she goes like this, and she says, San Bernardino. And the entire group is silent. Not my attending, not my co-residents, not my interns, not my medical students, not my pharmacy students, not my social worker. No one said a word. I was baffled. I just stood there humiliated, and it was just, there were no words. I left. We continued with rounds, but I was not happy, especially in light of everything that I have gone through, and that I was within my program where I have been a very, very vocal advocate on how to handle these situations. So it wasn't new to us. A few days later, rounding on the same patient, and to put it in context, she had recently been diagnosed with terminal lung cancer, so trying to be a little understanding from the patient's perspective, but recognizing that there's a line to be drawn. And she looks at me, again in front of 10 people, and says, your people are killing people in Los Angeles. And I stand there. And in that moment, I'm not really fazed anymore. I mean, I lost 3 family members who, there's not more to say. Like, I've given the ultimate sacrifice, and that people within my family are dead because of this. And I just stood there, and I was like, all right, I'm going to turn this into a teaching moment, because clearly no one knows what to do or how to do this. And I look around, and I'm just waiting for someone to respond. Silence. I sit down next to her bed, on her bed, and I say, Miss So-and-so, tell me what you mean by that. So kind of what you were saying, the exact same strategy is what I have come to. In the past, as a medical student, you're at the bottom of the totem pole. People can say all kinds of crap, and you just have to smile and move along. It was no different being a Muslim American as a medical student in Eastern North Carolina, being yelled at and attacked by patients because of my faith. And I smiled. And I thought maybe, because I'm the only Muslim they've ever met, that I can change their opinion on Muslims. And I carried this massive responsibility on my shoulders to change what they see on the news. But after February happened, I was like, that's it. I smiled enough, and this is where it got me. Now I need my voice to be heard. So I sat down next to this patient on her bed, and I made eye contact with her. And I said, Miss So-and-so, tell me what you mean by that. Help me understand. Have I done anything but give you compassionate, respectful care? Have I done anything to hurt your feelings or disrespect you? And I'm making eye contact with her and bringing it to a very human level. And she looks at me, and then she doesn't want to answer. She knows what she did was wrong. And in front of the entire team, she apologizes profusely and says, I am so sorry for what I said. That was wrong of me to do. There's no excuse. I'm Mexican American. I get the same treatment. I should know better. And in that moment, and our program had a conversation about this afterwards, and I share this because this is relevant to us, right? This is not just happening in the news, this isn't happening overseas, this is happening here in our institution, where we have these conversations where we are advocates of social justice, and this is who we are. And we all believe internally that this bigotry is unacceptable, but when we actually see it, we're silent because it's uncomfortable. So what do we need to do is we need to train ourselves. If and when I'm faced with this situation, I need to be ready to even just say, hey, like, that's not appropriate. Or hey, like, someone needs to stand up to me. My colleagues need to stand up for me because that's not okay.
Are you hopeful? Are you optimistic?
On any given day, that changes dramatically. I think if I'm going to be totally honest here, I'm not one to sugarcoat. I'm sorry if you want the PC answer, but I don't have one for you. Every decision to make a physical appearance, a public appearance, to do an interview, to be on this panel, you have no idea how much it takes out of me to repeat the fact that my family members have been murdered. I have PTSD. I am triggered day in and day out, working with patients who deal with a lot of trauma and suffering. But I'm hopeful when I feel like these words can have an impact on those around me to make a difference for someone else. I'm not hopeful in that I will never hug my brother again. I will never be an aunt to their children. I will never have holidays with them ever again, okay? These are nevers that are as real as they get for me and my family and my community. And it makes me very angry because we continue to have people like Trump say the crap that he does, right? And say that Muslims are deserving of bullets and I need to be banned from this country. So instead of, I could retract and just mourn and grieve and be on leave and never show my face to the world ever again. And I think I would be totally justified to do that. But when I come back and I see people like Trump on the national, platform, or when I come to the hospital and my patient is basically calling me a terrorist, the exact rhetoric that killed my family, she's attacking me of being a terrorist, no one else is speaking up on my behalf. And I'm tired of being my own advocate, to be honest. And that's why I'm here too, is to teach us all to be advocates for each other.
And Suzanne?